Hi, I'm Carrie. I'm a clinical psychologist. I work mainly with kids and teenagers. I provide individual and group therapy. I mostly work with individuals that have autism. And part of the reason that I got involved in working with children and teenagers in mental health in the first place was wanting more people to have the support they need for their mental health so that they can be the most successful and have the best life they can. Currently, I'm working at the Autism Center, and the reason that I started working more with people with autism was a couple of different things. So first, I started working with people who have autism after college and really enjoyed it. And as I started grad school, I realized how much need there is for support and faster diagnosis. And so this is work I continue to do because I'm passionate about supporting people and trying to do work that gives every person the best chance to be the most successful, especially by having the most accurate diagnosis and the most effective treatment possible. First meeting with me, usually like to just introduce myself and get to know you. And then, honestly, I'm gonna ask a bunch of questions, and there's a reason for that. I wanna get to know you, get to know your child, get as much information as I possibly can so that I can offer you the most support. And then after that, if you're seeing me for therapy, then a lot of it's gonna focus on figuring out what treatment's probably gonna work best for you based on the research, and also kind of working together on what's gonna work best for you based on the stuff that you like, based on your strengths and stuff like that. So a lot of it's gonna be questions, getting to know each other, and just figuring out together what's gonna work best for you. Now, if somebody's coming to see me for therapy, that can look like some different things. So a lot of it may focus on strategies that might be most helpful for you with doing the things that you need to. Now, sometimes that might be something like learning cognitive behavioral strategies to manage some of the things that are going on for you as an individual. And for families, that might also be just talking through different strategies you can use with your kids, your teenagers at home that are likely to be the most effective, not only for things like managing behavior, but also focusing on continuing to build the positive relationship that you already have with your kids. Now, I mentioned cognitive behavioral strategies. The truth is, there's a lot of different strategies that I work with people on. My main focus is just what seems like it's going to work best for a person based on their strengths, their needs, and also what it looks like is going to be the most helpful based on the research. Mainly, I use CBT, but I also use a lot of other interventions too, just kind of depending on the person and what it looks like is going to be the best fit for them. So I was actually born and raised in Louisville, Kentucky. I got my bachelor's degree from University of Louisville. Proud Cardinals fan. And then after that, I got a master's degree at Western Kentucky University. And then I went to Spalding University right here in Louisville, Kentucky to get my doctorate in clinical psychology. And since then, I have been in Missouri, completing my internship and postdoctoral training and beginning my career. And now I'm back here in Louisville, happy to be back home. For fun, one of my favorite things is I like to spend time with my family and friends, do different things. I love being outdoors, so I try to be outside whenever I can. I also got into running after grad school, so sometimes I run. I love reading everything, fiction, nonfiction, playing volleyball, doing yoga, and when I can, going to a good Cardinals game.